should know is that everybody has some level of sensory discomfort to a certain degree. It does not become classified as a sensory processing disorder until it starts to truly impact the way your life is lived on a day-to-day basis. So basically, sensory processing disorder is a condition in which the brain is not processing sensory information in an appropriate manner. And in this case, it turns into a hard situation for individuals or children to respond and react to just typical day-to-day activities. So some children may have trouble with tolerating clothing, they may have trouble with loud noises, they may have trouble with touching different textures, they also may become picky eaters. And these are just a few examples of when sensory discomfort actually turns into sensory processing disorder. The second thing that you should know about sensory processing disorder is that there is no cure for it. So that just means that there's no medicine or surgeries or anything like that that's gonna cure it. However, there are some therapeutic interventions and activities and strategies that can be performed and taught in order to help individuals learn how to cope and manage their sensory processing challenges. The third thing that you should know about sensory processing disorder is that it is typically treated by a profession called an occupational therapist, which is something that I do. I'm a pediatric occupational therapist, and we treat individuals across the lifespan to help them be as functional and as independent as possible. But in cases when children have sensory processing disorder, we typically are the ones who would treat those children. Thing number 4 that you should know about sensory processing disorder is that there is not one set cause for it. Researchers are still working right now as we speak, trying to figure out what are the causes of sensory processing disorder. There have been many hypotheses as to what is the underlying cause of sensory processing disorder. Some have said that it's due to a genetic predisposition. Some said it's due to children that may have different brainstem structures, prematurity, pregnancy complications. So there's a lot of theories out there. So there's not just one thing that has been known to cause sensory processing disorder. The fifth thing that you should know about sensory processing disorder is that not every child who has sensory processing disorder also will have autism. However, majority of children who do have autism also have sensory processing disorder. So just remember, in case your child is one that is showing some sensory challenges, that does not automatically qualify them as having autism. So if you are interested in learning so much more about sensory processing, what sensory processing disorder is, how it impacts the child in your life, as well as some common activities and strategies that you should try out with your child to help them with their sensory needs, I have the solution for you. So I have developed a course. It's called a sensory crash course, a sensory course for beginners. So if you are new to this whole sensory processing thing, you may have heard of it but not quite sure what it is, or maybe your child is showcasing some odd behaviors and you're not sure exactly what's going on with them, and you want to learn more about sensory processing, well, make sure you click on the link below this video where you can go ahead and take the course. It's self-paced, and that means you can just kind of take it on your own timing. But thank you guys for watching, and I'll see you in the next one. Bye.